So I'm very happy to introduce you all to Heather Medicine Bear of the National Native Network. It's truly important to have our sibling giving this presentation with us, as you know, African Americans are not the priority population of Washington State. So it's very, very important that she's here. And Heather, you can take it away.
Thank you, Ashley, and thank you so much for having me today. You did such a wonderful job articulating the historical, social, and cultural context related to tobacco use, slavery, racism, capitalism. Our histories aren't always easy to talk about, but it's essential in public health that we have this understanding of these truths, that we share these truths, so that interventions are effective for our populations. It's really an honor and a privilege to work side by side with the Center for Black Health and Equity as a sibling network to reduce disparities and improve health in our respective and intersecting communities. So my name is Heather Medicine Bear. I'm an enrolled member of the Gila River Indian community, Akimel O'odham. I'm the program manager for the National Native Network. I'm also a mother of 3 little boys, and I'm finishing my doctorate in Indigenous health through the University of North Dakota. My interests lie in public health advocacy, building health equity, tribal capacity in health, tribal data sovereignty, and culturally safe research methods, and community-based participatory programming. A little bit about the National Native Network. So we are a network of tribes, tribal organizations, health departments, state programs. We are administered by the Intertribal Council of Michigan, and our board of directors include the California Rural Indian Health Board, the Southeastern Alaska Regional Health Consortium, the Great Plains Tribal Leaders Health Board, and our mission is to enhance the quality and performance of public health systems to reduce commercial tobacco related illness and cancer disparities among American Indian and Alaska Natives. So we've reached in our direct service about 134 tribes with an additional 385 within our agency's peripheral purview. Next slide, please. In this presentation, I'll be using the terms traditional tobacco and commercial tobacco. The term traditional tobacco describes natural tobacco grown and harvested by our populations, by tribes for ceremonial and medicinal purposes, whereas commercial tobacco represents that which is manufactured with nicotine, additives, carcinogenic compounds that's linked to disability, death, and disease. Traditional tobacco I'm also going to be using the word sacred tobacco interchangeably. Next slide, please. So tobacco has a very long and complex history among American Indian populations, predating European contact. For a very long time, we have cultivated and used tobacco for medicinal, ceremonial, and social purposes. We use it in prayer. We use it to seek guidance. We offer it as a sign of respect when we ask for knowledge or for somebody to share a story. And it still continues to play a very significant role in cultural, spiritual, and economic practices of various tribes. Every tribe is different. So there are, 500 something federally recognized tribes in the United States. Each has their unique history and relationship with tobacco. So the impact and the history of tobacco can vary among different tribal populations. So the original form of tobacco is known as Nicotiana rustica, and this is grown in various parts of Northern America before European contact. It's a lot harder to come by these days. It kind of looks like basil. It's very resilient. It can grow in harsh conditions. There's not many viruses or bacteria that attack the plant, so it can be used as a pesticide. The other form, which is now used in commercial tobacco, is Nicotiana tabacum. So this is this plant is attractive to commercial tobacco interest because it produces more tobacco per plant. It's easier to grow. It's less irritating. So it's better to mass produce. Both of these forms originated in South America, and the rustica still grows wild in Central America and some parts of North America. So tobacco companies have modified in tobacco to enhance certain traits for flavor and growth. Today's version, much like other commercialized crops, bears little resemblance to its natural ancestors. When Europeans arrived to America, they encountered the use of tobacco by Native Americans and quickly adopted the practice. So it became a very important commodity in the transatlantic trade, and European colonizers established tobacco plantations to export this plant back to Europe. Centuries of European encroachment on American Indian land has made it very hard to grow and access the plant from its original form. Warfare between Indians and settlers changed the landscape of America. Culture and tradition was wiped out, and in that tobacco changed. It took on a new purpose. It turned into something less sacred than what it was originally used for. Next slide, please. So colonization brought about so many detrimental effects on Native American communities. So the introduction of new diseases, land dispossession, forced assimilation, cultural disruption. After colonization, 90% of the indigenous population of North America was wiped out. This because of violent tactics from the colonizers: disease, war, starvation, displacement. There were seizures of land by European powers. Native Americans were forced to relocate or confined to reservations. This resulted in a loss of, disruption of traditional ways of life and loss of ancestral territories. The European demand for tobacco grew and more land was required for plantations. So of course, more Native Americans had to be removed from their tribal homelands, and more Africans were needed as slaves. The colonies of Maryland and North Carolina were two of the greatest tobacco producers in after Virginia, and they exported thousands and thousands of pounds to Europe, pounds of tobacco to Europe every year. As tobacco became more popular, more businesses were established, the cultivation and sale just increased the need for more land and more work. So the original use of tobacco was forgotten. The plant just became this lucrative cash crop for the Americas, and it is said to have fueled the colonial economy. So the goal of colonization is not only to eliminate the indigenous population, but to assimilate them to their beliefs and values under threats of death and violence. This hegemonic practice results in the suppression of native languages, religions, cultural practices. It causes economic disadvantage. So the introduction of the European economic system of private land ownership and market-based economies disrupted traditional indigenous ways of life. Many American Indians were forced into poverty. They lost their political autonomy. So tribes were under the control of the US government. There were misleading treaties, which resulted in further land loss and relocation. This has caused intergenerational trauma, which the loss of identity, socioeconomic challenges, they have very long-lasting psychological, social, and economic effects on our population. This has increased health disparities, the increased onset of chronic disease, substance abuse issues, systemic issues, and of course, the increased burden of commercial tobacco use in our populations. So regarding tobacco products, we see this continued pattern of colonization by the industrialization and modifying of tobacco. So developing the tobacco plant as a plantation crop, adding additives to cigarettes, just taking away from all the sacred uses of what tobacco originally was. Next slide, please. Furthermore, into the history of a little bit more history. So that the Indian Removal Act, this was signed into law in 1830. So this authorized the president to grant lands west of the Mississippi in exchange for Indian lands within existing state borders. This was the beginning of what we know as a Trail of Tears. So 60,000 American Indian people were relocated from their lands, and approximately 4,000 died at that time. between 1869 and the 1960s, there was this broader assimilation practice of aimed to civilize American Indians, believing that Native Americans were inferior and needed to be replaced by their beliefs and culture systems needed to be replaced by American values and practices. And boarding schools were seen as means to achieve this goal. So American Indian children were taken from their homes forcibly. Their parents were under threat of violence and prosecution if they tried to keep them away from the boarding schools. There are instances of violence, sexual abuse, discrimination, death within the boarding schools. Thousands and thousands of unmarked graves of children are still being found today based on their attendance to these boarding schools. The goal was for the children to assimilate into the Western way of thinking, Western ways of knowing, and in so doing, suppressing Indigenous languages, traditions, and spiritual practices, which were all forbidden. Children were punished for expressing their cultural heritage at the time. And then there's a mistake on the slide. It should say 1953. The U.S. Congress established some termination policies that were started to end the protected trust status of Indians on their own lands. In response to this policy, the BIA began what's known as the Indian Relocation Program, where they relocated American Indians to urban areas with the hope of finding more employment and better opportunity. But in the end, this was another forced assimilation practice where there was economic disadvantage, discrimination, loss of culture, and these are all related to current health impacts, and have cultivated this very confusing relationship between American Indians and their sacred practices, especially within elderly populations who were part of the relocation programs, and the boarding schools, who sometimes refuse to even talk about what their traditional practices have been. And it's very, very sad when you're speaking to your grandmother or an elder and they refuse to talk about what happened, for one, what happened to them in the past, and two, what they know about their sacred traditions and history. It's very painful. Next slide, please. So the Code of Indian Offenses, so as we're seeing Indigenous knowledge, values, and behaviors and protocols being suppressed through colonization, have sought to eliminate Indigenous knowledge, values, and behaviors, including the use of sacred tobacco. So the Code of Indian Offenses prohibited Indigenous people from the rights to perform cultural and traditional ceremonial practices. Many of these ceremonial practices include the use of traditional tobacco. It wasn't until 1978 that the Indian Religious Freedom Act was implemented so that they could start using their sacred tobacco again. During the time when all ceremonial and traditional practices were being banned, however, they were using commercial tobacco instead of traditional tobacco in ways to kind of like secretly still practice ceremony and prayer. So there begins this confusing relationship between commercial tobacco and sacred tobacco at that time. So people using cigarettes and smoking within ceremony confuses the real, what you're supposed to be doing with the use of the traditional tobacco. Just an example of that is I asked one of our knowledge keepers to share stories with my class. I teach at Hawaii Pacific University, a culture and health class, and I didn't have any tobacco to offer him, any natural tobacco. So the first thing that came to my mind was, well, I could buy him a pack of cigarettes, so I could give him tobacco, So that's the kind of thing that's going on in our communities and has been for a very long time. Next slide, please. So decolonizing tobacco. So tribal leaders, they want to implement these movements to boost traditional tobacco use. This is not just for the sake of rebuilding vanishing traditions, but also a strategy to reduce commercial tobacco in our communities and preserve traditional ways of life. So teaching community members about the use of traditional tobacco, funding different programs that promote the use of traditional tobacco. These are all very important things to be doing right now. The United Nations Declaration on the Rights for Indigenous People states that, Indigenous people have the right to their traditional medicines. They have the right to the enjoyment of the highest attainable standard of physical and mental health. As Indigenous people and non-Indigenous allies, it's important to reflect on these acts of colonization, on the impacts on Indigenous communities for their health and well-being. And this includes delineating the difference between commercial tobacco and ceremonial tobacco. Using precise language to justify these understandings is also important. So policies that recognize, protect, and revitalize ceremonial tobacco, integrating the use of ceremonial tobacco into different programs, delineating between the two terms. So language is important. So using the term commercial tobacco instead of just tobacco standing on its own can be helpful. Promoting understandings and respect of cultural significances of sacred tobacco and meaningful engagement with Indigenous leaders to develop and implement certain plans is important, and recognizing the need to fund research and public health promotion activities that revitalize ceremonial tobacco is also important. So, colonization is not a historical artifact or just a moment in history. It continues to harm. There are systemic effects of colonization that have impacted us for a long time, that are still impacting us. So the work that we do is very important in promoting health and wellness in our communities. Next slide, please. So commercial tobacco use in American Indian, Alaska Native communities today. So we have a very disproportionate prevalence of commercial tobacco use. It's about 43.3% compared to 27.7% of non-Indigenous groups. Big tobacco companies use targeted marketing strategies. So they partner with tribes to brand and sell cigarettes, provide financial support to cultural events, use American Indian and Alaska Native imaging and symbols on their cigarette packaging. They disseminate misleading information about the effects of commercial tobacco products, reduce prices on tribal lands. The big tobacco companies have actually been very friendly with American Indians. They are one of the few outside groups that strongly supported tribal sovereignty and economic development. So tribal casinos, that's one of the biggest places where there's such high tobacco usage. So there's this very confusing relationship between tribes and the big tobacco companies, because the big tobacco companies have always been supportive of them, but the tobacco companies continue to adulterate, manipulate. There's just so much harm that comes from this. And we know big tobacco companies, they don't care about the health and well-being of the populations that they're exploiting. They are not doing what's right. They're trying to fill their pockets. So that's why educating our people on this big difference and why it's harmful is so important to us. So the social determinants of health in our communities, economic disparities, lack of access to preventative care, those are all things that increase, allostatic load, which has cumulative effects that exacerbate the health problems in our communities. So stressful living situations, financial disparities, food insecurity, discrimination, violence, other traumatic life events. This all leads to smoking and stress and just disabling and deadly health issues. Next slide, please. A big problem in our community is also teen vaping. So this study by Colorado State University, so 19.9% of youth in grades 8 reported using vaping products. More than half of survey respondents said that it's very easy for them to get vape products, and 77% of the youth surveyed did not perceive vaping as something that was harmful to them. Next slide, please. So the NNN, what we do is we really like to take a strength-based approach on things. So we identify emerging, promising, and best practices. We highlight and disseminate success stories. We provide tools, technical assistance, and implementing policy, systems, environmental approaches. This is all the way from planning to enforcement, evaluation. We engage ever diverse collective of stakeholders for capacity building. We have toolkits, data, culturally appropriate data collection, education, digital storytelling, roundtable discussions, podcasts. Next slide, please. This is just an example of one of the projects we worked on with the CDC. So they did the Tips for Former Smokers campaign, and we translated them from English into some of our tribal language. So Anishinaabe, Lakota, Tlingit from Alaska. Next slide, please. We promote the American Indian Tobacco Quit lines. Next slide. We have our digital stories. I can put the link to some of these in the chat in a minute, but they're just, they resonate with our community because they're stories told by our community members on how they quit smoking, why they quit smoking, and some of the resources that they used. Next slide. We have the State Initiative for Tobacco Equity. So we work with the states. We provided education, strategies, and this year we're working on connecting them with their tribal partners. Next slide. And we have the Breath is Sacred campaign, which was done by the Intertribal Council of Michigan in partnership with the Truth Initiative. So they had these really beautiful images depicting strength and culture and resilience and health within our communities. And then these phrases that, promote cessation. Next slide. So current and proposed policies, most of you are all probably very familiar with these. So the Family Smoking Prevention Act, price and tax increases on commercial tobacco products. So this is a tricky area in our population because we have tribal sovereignty and we are not, tribes are not required to follow through with state regulations. So it's up to the tribes to figure out if they want to increase price and taxes for tobacco products on their lands. Smoke-free policies, I recommend looking up the Air is Life campaign from the Navajo Nation. So it was a 10-year campaign where they have now implemented policy to eliminate tobacco usage in public areas. And next slide, please. And then some of the recommendations for policy, supporting smoke-free policy on tribal land, increasing prices and taxation, increasing federal funding for tobacco prevention, restricting marketing schemes, reducing nicotine levels, restricting sales of flavored tobacco products, integrating culturally appropriate screening policies, supporting American Indian participation in the development of laws, and then very robust and culturally appropriate commercial tobacco use surveillance systems in our communities is also a recommendation. And so that is all I have for my presentation. I really, really appreciate the time that you've given me today. And Ashley, again, thank you so much for inviting me. Margaret, thank you for having me as well. And thank you all for listening.
Thank you so much, Heather. This is really, really important to hear and learn this. A lot of this I have not heard before, did not know. So you don't know what you don't know. And I hope I'm not the only one whose mind has been totally blown today. So thank you so much. I know we're right at time, but I just wanted to give people, if you're willing to hang on, if there's any questions or just comments or just you want to share how you feel from after seeing and learning what you learned today.
I want to share my thanks with Ashley and with Heather. Those of you here, if you want to give them a little round of applause, please do, or react with your Zoom reactions. Thank you for extremely informative afternoon.